Toffee, excuse me. Please excuse me, Toffee. Hi, very good evening. So today's live session will have few questions from dental anatomy, right? So we have set of 10 questions. We'll try to complete the session as quick as possible, right? Within 20 to 25 minutes maximum, right? So once again, a very good evening. So we'll start with our first question. Yeah, so Toffee will be accompanying us in this particular live session. So Toffee will be there. And if at all you find that it's hindering the view, do let me know. Also do confirm whether it is streaming fine, and also let me know whether the voice is clear. If you want me to raise my voice, I can do it for you. Hi, a very good evening. So if it's all fine, we can proceed with our first question. What do you say? Okay, perfect to hear. So we'll start with our first question. So as I said, we'll have one live session, one academic discussion every week through live. So this week, we're having it today, Friday, 8:30 p.m. Indian Standard Time. The reason why I'm telling you this is, now is an opportunity for us to learn certain important points pertaining to dental anatomy, right? So let's make maximum use of this particular session, maximum of 20 or 25 minutes of time to have some fun and simultaneously learn some important points pertaining to dental anatomy. And remember, we're not going to get this time again. So let's make maximum use of the available time now, and that's the reason why I keep on saying, let's keep giving our best each and every moment, which is the key. And if we focus on this, then eventually we'll have successful, natural, successful outcomes, isn't it? So we'll start with our first question. Seems pretty simple, but I have tried to make the options more complex, so let's see how it goes. Okay, I'll definitely raise my voice. So the first question is, oblique ridge extends from. Okay, Toffee, you can mind your work on the floor. In the meantime, we'll have a session, okay? So first one, oblique ridge extends from. So you have the following options. Option A, mesiobuccal to distopalatal. Option B, distobuccal to mesiopalatal. Option C, mesiobuccal to mesiopalatal. Option D, distobuccal to distopalatal. So I try to jumble up these options and words, so in order to confuse you as much as I can, so do choose the appropriate option. So as you know, oblique ridge, it's a ridge, a linear elevation which is extending obliquely in case of maxillary first molars, permanent maxillary first molars. So what are the cusps it joins in the process of extending on the occlusal surface? So it's like a standard equation more or less, right? So mesiopalatal, which is considered as the largest cusp, and from mesiopalatal to distobuccal cusp would be the extension of your oblique ridge, as you all rightly mentioned. So option B is right answer. And also, as you can see in the image, we have mesiopalatal cusp, which is the largest, and from there you have a ridge extending onto distobuccal, right? Now, if I ask you one related question pertaining to this, what is the order of various size of the cusps? If I ask you to arrange the size of the cusps in descending order, what would be your answer? I mean, you have your maxillary first molar, you can see the occlusal surface with 5 cusps including cusp of Carabelli, even though it's not very prominent. So what would be the order of the size of the cusps in descending order? Hi Ankita, very good evening. Exactly. The occlusal surface. We'll discuss that, Dinty. We'll discuss your particular question subsequently. You say it's same as in case of deciduous maxillary second molar, that's right. Good, Sandeep. So Sandeep has given a very quick response. Ramya 2, Ria, Anurimia, good. So mesiopalatal would be the largest cusp, followed by mesiobuccal. remember jet-shaped pattern, right? So often we get confused and have highlighted this n number of times, so let's make this opportunity to stress upon this particular point. The size of the cusps follows a jet pattern. So mesopalatal will be the largest, followed by mesobuccal, distropalatal, and then distrobuccal is the smallest cusp. Obviously, cusp of Carabelli comes at last because it's a rudimentary kind of cusp, right? So that's the order. Just remember jet-shaped pattern. Jet-shaped pattern starting from mesopalatal, mesobuccal, distropalatal, and then distrobuccal, right? So that's the correct order in descending way pertaining to size of the cusps. I see most of you giving mesopalatal, mesobuccal, distrobuccal, and distropalatal. Do refer Wheelers once again, and you can get back through mail for any further clarification, right? So remember this jet-shaped pattern. Okay. Now let's move to the next question. Identify the tooth. So let me not give you any hint initially. So try to identify the tooth based on, I think you can see some reflection, right? The reflection of the board. So let me just angulate the monitor. Just give me a few seconds, right? Since you have the black image, there seems to be some reflection. In the meantime, try identifying. Yes. Okay, this seems to be better comparatively. So identify the tooth based on the clinical representation or illustration. So obviously it's a premolar, that's understood. And I see most of you giving it as maxillary premolar, which is too good. So it's maxillary premolar, that's right. So is it a first premolar or second premolar? That's the challenge we have now. So how do you identify and how do you justify your answer? I see most of you, Rohit says maxillary is second premolar. Rohit, I guess you said it's second premolar because it has a single root, right? But don't you think even maxillary first premolar has a single root in some occasions? There can be exceptions, right? Even though you know the fact that maxillary first premolar has two roots, buccal and palatal, but there can be exceptions. There can be union of two roots. So don't you think it can be an exception? Akilo has made a very valid point. Good, Akilo. Mesio-marginal groove in maxillary first premolar. Yes, Ramya has made a valid point. See, that's the advantage you have when you have proper reference and information. So Ramya says it can be first because of mesial concavity. So guys, can you make out mesial concavity here? You can see mesial depression in the crown extending onto the root. So where do you see this mesial concavity? Don't you think it's a characteristic feature of the first premolar? Then what about the roots? Exactly. So you have mesial marginal groove if you carefully observe. As you can see, we have a mesial concavity and also you have a mesial marginal groove, which is a characteristic feature of maxillary first premolar. The exception here is you have a unified root. Right? There can be cases where there can be unified root even though maxillary first premolar in general has two roots, right? Buccal as well as palatal. But so before moving on, so this is a comparative analysis. You can see there are two images, right? So the left one is the one which I have posted now, which I have asked you now, representing maxillary first premolar, right? And the right one, it is maxillary second premolar. So in order to have a comparative analysis so that you would know to differentiate a first and second premolar, I put up these images. So the left one represents maxillary first premolar with mesial developmental groove and mesial concavity, and the right one, as you can see, there are no such features, right? You have two cusps and a single root. It's a maxillary second premolar. So all of these or both of these are pertaining to the right side. Okay. So before we proceed to the next question, if you think the video is not clear, do try watching the video in HD or stream it at higher definition. And also let me know if the voice is not clear so that I can raise the voice. And don't worry, once we complete the session, once we complete all the questions, I'll give you a summary of all the questions which we have discussed so that you'll be missing literally nothing. Okay? So let's move on to the next question, the third one. Mandibular first molar is longer buccolingually than mesodistally, longer mesodistally than buccolingually, equal in length buccolingually and mesodistally at the cervix, both B and C. So which among the following options do you think are more appropriate and true pertaining to mandibular first molar? So mandibular first molar, as you know, see we have these dimensions and unfortunately we have to memorize them. And the basic concept is that lower molars, mandibular molars, permanent molars are comparatively longer mesodistally than buccolingually, isn't it? But in case of upper molars, they are comparatively longer buccolingually than mesodistally. I'm sure you're aware of this fact, and also based on your clinical examination, you might have this information with you. So let's look into the dimensions, right? So that we'll get an accurate picture. So I don't think it's very clear, so let me just zoom in. So as you can see, mandibular first molar, you can see the mesodistal diameter of crown, which I'm pointing out. So we have fortunately pointed in the screen itself. So it is 11 mm. So mesodistal diameter of crown in case of mandibular first molar is 11 mm. Mesodistal diameter at the cervix is 9 mm. Buccolingual diameter of crown is 10.5. The same buccolingual at cervix is 9 mm, which means mesodistally and buccolingually, the molar has same dimensions, that is 9 mm. But when you look into the overall diameters, mesodistal is 0.5 mm greater than buccolingual. So we're trying to just analyze the given dimensions and we're trying to correlate with the options given here. Now if you look into this question again, mandibular first molar, option A states that it's longer buccolingually than mesodistally. So it's completely false. The reverse is true. Option B, longer mesodistally than buccolingually, which is true because mesodistally the dimensions are 11, whereas buccolingually it is 10.5 mm. And option C, equal in length buccolingually and mesodistally at cervix, which is true because the dimension is 9 mm at the cervix, either buccolingually or mesodistally. So, based on the interpretation, option D is right answer. Now I know it's a tough question because it's based on calculation, it's based on dimensions, it's based on memory. It's a tough question, but you've done extremely good, right? So I think most of you chose only one right option, but we have two right options for this question. Option D. Fine? Exactly, Andrew. In case of maxillary, the scenario will be reversed. Buccolingually, the tooth is longer than mesodistal diameter. Now let's move on to the next question. Guys, now we have rapid fire, okay? So I'll present the question, just give you less than 2 minutes time. Try to answer as fast as you can. So we have set of rapid fire questions, around 7 questions. So let's go at a rapid pace. I hope you are ready. So we'll have our first rapid fire question. Primary tooth which resembles permanent maxillary first molar. Just answer it as fast as you can. Primary tooth which resembles permanent maxillary first molar. So identify the primary tooth which resembles permanent maxillary first molar. In fact, one of you has given a hint in the prior questions itself. Exactly. So maxillary second molar. Deciduous maxillary second molar resembles permanent maxillary first molar. Similarly, deciduous mandibular second molar resembles permanent mandibular first molar. Right? Very good. So let's move on to the next question. So try to answer as fast as possible because let's justify the name rapid fire. Primary molar with prominent mesofacial cervical ridge. Primary molar with prominent mesofacial cervical ridge. Especially in third year, you might have carved primary teeth and you would have placed a prominent mesofacial cervical ridge for one tooth, one posterior tooth. I have given you the answer. If you're giving me wrong answer, it means you haven't done your carving and you made your friends get your carvings done. Exactly. Primary first molar is right answer. Primary mandibular first molar is something which is very strange in appearance, isn't it? It has a very bulky mesofacial cervical ridge. Right? Good. Mandibular first molar. Deciduous mandibular first molar is right answer. Wonderful. Now, let's move on to the next question. Next rapid fire. Longest crown. That's it. Longest crown in the entire dentition. Hi Saima, very good evening. Now you should be more specific, right? Is it, you said canine, but is it maxillary canine or mandibular canine? Longest crown. Okay, let me give you a hint. The dimensions of maxillary canine. The length of the crown is 10 mm. The length of the root is 17 mm. In case of mandibular canine, the length of the crown is 11 mm. The length of the root is 16 mm. So I've given you the values. Now try answering the question. It's like I've opened the peel of banana. Now I'm asking you to eat it. See, maxillary canine, mandibular canine, both are longest teeth. That's understood. But we're talking about longest crown. It's mandibular canine, which has a length of 11 mm. Hi Prerna, it's good to see that you're participating in the session. Impressive. Yes, it is mandibular canine. As I've given you the dimensions, you can cross-check once again. So Anika says maxillary canine longest root. Okay Anika, don't spoil the session by giving the next question, because the next question is on the same. Longest root. Hi Bernice, a very good evening. It's really glad to see you. So Bernice is our first batch student. I'm very happy to see you participating in the session. Bernice, how are you? Exactly. Longest root, maxillary canine, as I have given you the dimensions, right? 17 mm. So longest crown, mandibular canine. Longest root, maxillary canine. Longest tooth, it's both maxillary as well as mandibular canine. I hope it's clear. Now, largest tooth. Good to know, Bernice. So which is the largest tooth? So largest tooth would be, in terms of size, overall dimensions, when we say larger. Okay, I see combination of maxillary and mandibular first molars, but largest tooth is maxillary first molar, right? Yeah, permanent first molars, permanent maxillary first molars. Which is the smallest tooth in the entire dentition? Which is the smallest tooth? Lateral incisor. Ramya says mandibular primary incisor. Monica says mandibular second premolar. We're talking about smallest tooth in the entire oral cavity, which obviously includes crown as well as root. Yes. lower central incisors. Even in both dentitions, that's the same scenario, right? So primary mandibular centrals or permanent mandibular centrals, right? In entire dentition, primary mandibular central incisors are considered to be smallest tooth. Good. The last question in rapid fire, premolar with 3 cusps. Which is a premolar which has 3 cusps? So is it maxillary? Let me give you options to confuse you. In fact, if I give you options, it will be more confusing. Maxillary first premolar, maxillary second premolar, mandibular first premolar, mandibular second premolar. But most of you aren't even waiting for options, and you're giving me the answer directly, which is a very positive sign. Of course, it is. Dr. Selva says 35 and 45. Smart answer. Lower second premolars. We have 2 cusp type and 3 cusp type. Depending upon the number of cusps, you have Y-shaped, head-shaped or U-shaped occlusal patterns, right? This is very important. Good. So you've done extremely good in all the rapid fire. So it's not that the questions are easy or difficult, but what matters is active participation, and what matters is what we are learning at the end of the session. So before I conclude the session, I would like to review all the questions for you once again, so that those who have joined late can have a chance of going through all the questions once. And also I have one general question for you, right? We'll have that after the review. So we'll have our first question. Hi Monica, glad to hear that. You're most welcome, and I appreciate your feedback. Thank you. So oblique ridge. As you know, ridge is a linear elevation which extends from one particular area to another particular area. In this case, oblique ridge extends from mesopalatal to distobuccal cusp, which is quite obvious in this image, right? So you have a largest cusp, mesopalatal, and from there the oblique ridge extends on to distobuccal. And the size order of the cusps is very important. Either descending order or ascending order. The largest cusp to smallest cusp, the sequence you need to understand, you need to remember, right? So don't get confused. Remember jet-shaped pattern. Mesopalatal followed by mesobuccal, distopalatal, distobuccal, and then the cusp of carotid. Now, I asked you to identify these two. You've done extremely good, and I'm totally impressed. In fact, I didn't expect even one of you to answer it right, but you did. So even though it seems to be having a single root, but because of presence of mesial concavity and mesial developmental groove, it is maxillary first premolar, right? Right maxillary first premolar. And to differentiate this from second premolar, we have a comparative analysis here. So in second premolar, you have a flatter surface, isn't it? And third question, mandibular first molar is. So this is definitely a difficult one because it's based on numericals, it's based on ability to retrieve from your memory. So you can expect these kind of questions as well. So for this reason, try to memorize all measurements, all dimensions of tooth, which is obviously very important, right? Even though they might not ask you the value as such, you can have a comparative approach in this format, right? So mandibular first molar is longer buccolingually than mesodistally, longer mesodistally than buccolingually, equal in length buccolingually and mesodistally at the cervix. Option D, both B and C. So both B and C are right. I'm not going to explain you the options, but I'm going to give you the values based on which you can analyze. The mesodistal width of mandibular first molar is 11 mm, buccolingual width is 10.5 mm. But at cervix of the tooth, of the crown, both buccolingual and mesodistal dimensions are the same, which is 9 mm, right? Now, often students ask me like how to remember. See, it's not possible for remembering these values for lifetime. It's that you prepare now. At least now you might have this particular topic in your mind fresh because we have discussed now. So make notes, and it's through repeated revisions that we master any memory-based topic, right? It's not that we just learn like that. You learn, it stays in your memory fresh, and you make notes, and then you repeatedly revise time and again, and even before the exam. That's the reason why I insist on making notes, so that it helps you to keep your memory fresh, it improves your confidence, and most importantly, it saves your time, right? Now, the rapid fire, we have the following questions. Primary tooth which resembles permanent maxillary first molar, as you have rightly said, it is deciduous or primary maxillary second molar. And primary molar with prominent mesofacial cervical ridge. I'm sure you are experts in carving. It's deciduous or primary mandibular first molar. Longest crown, we tend to get confused, but remember the length of the mandibular canine crown is longer than maxillary canine. Mandibular canine it's 11 mm, maxillary canine it's 10 mm, right? Longest root it is maxillary canine, okay? It's 17 mm in case of maxillary canine, 16 mm in case of mandibular canine. Again, it has something to do with the measurements. Even though you don't exactly remember it, at least try to have this comparative approach. Largest tooth in terms of overall dimensions, maxillary first molar. Smallest tooth, mandibular central incisors. Premolar with 3 cusps, as you all rightly said, mandibular second premolars. And let me ask you one related question. Which tooth is considered as an enigma to an endodontist? The entire dentition, which tooth is considered as an enigma to an endodontist? Enigma is something which is difficult to understand, complicated, and not so easy, right? So it has several meanings. So which tooth in dentition is considered as an enigma to an endodontist? Or an endodontist, future endodontist? Sandeep, smart answer, right? Okay, it's given the numbers. Mandibular first premolars. So why do you think they are considered as enigma to endodontist? It's mandibular first premolar. Good. Yes, Raghu. Kirti says first premolar. Nahida. Yes, Monica. Yes, lingual inclination or lingual tilt of crown to 30 degrees would make it challenging for access cavity preparation or even cavity preparation. Diverse morphology, as Lakshmi has rightly said. Kirti says root morphology. Yes, Raghu, lingual inclination. Yes, as Kartika Nayak rightly says, there can be additional canals, there can be beams or vertices modifications, 1-2-1, 1-3-1 configuration of root canals. I have discussed those configurations in YouTube as well as in E-classes, right? Yeah, there can be bifurcations, lingual tilt, canals, right? Exactly. Because of this complexity, it's considered as an enigma to an endodontist. Good. Yes, Akila. Yes, Dr. Salwa says variations of canal. Abhishek Gupta says also 3 canals. Yeah, there can be trifurcation, bifurcation. Good. So we're done with academic part. We have one general question. So place. So no GPS coordinates this time. I hope you can see the picture clearly. The video has stuck for a few seconds and I thought it's gone again. But luckily it seems to be streaming fine. I think the angulation of monitor is also very important because there seems to be a lot of reflection. So next time we'll make sure that there is no such issue. Okay, let me give you a hint. I have shown you this image in one of the recorded videos very recently. So that's the only hint I can give you. So Ramya says Mount Everest. No, it's not Mount Everest. Bernie seems to be very smart. She gives a generalized wide answer, Himalayas. Of course, it can be, see there are hundreds of peaks in Himalayas. Good, Bernie. So Akila says Himalayas. Kirti says Switzerland. Kirti, I'm not so biased to only post pictures of other countries, right? I do post even pictures from our countries and neighboring countries. Ria Darshil says Nepal. Preeti, Jaya, Rahil. Yes, Rahil, what do you think? So everyone says Himalayas. See, Himalayas, it's like, so you can answer in this way in your vivas. But you have to be more specific here. Vivas mein chalte rahe. University theory exams mein chalte rahe. So if assume that you have this question in your university exam, you have no idea about it, and the first thing you would do is, the first point, the following image contains blue sky. Second point, there seems to be greenery all over in the form of hills. Third point, you can see snow-capped mountains. Fourth point, they have varying heights. fifth point, all 4 points combined, and I'm sure you will get excellent marks in your university theory, or maybe in even Viva, but you have to be more specific here. Parampreet, hi from England. Hi. No, that's what usually happens in university theory, right? I think you can even add up some additional points. So there seems to be like very thin clouds, and there seems to be scanty snow, and there are 4 peaks in this particular image. So you can add up as many points as you can see. University theory exams are places or situations where your creativity pops up. So I'm sorry, this is not my photography, this is from Wikipedia, so I can't take credit for it. I'll show you my photography as well. So we were not so fortunate to pick this from such a closer distance. Chardham ki yatra, okay, right. So as I said, I posted this image in one of the recorded videos. It is Machu Picchu. This peak you can see, I mean if you closely observe, it has 2 peaks, like a fish tail. Hence it's called as Machu Picchu. Machu Picchu in Nepali, it means fish tail. So it has an altitude of around 6,900 meters or around 24,000 feet above sea level. And since it resembles fish tail, it's called as Machu Picchu. I think I tried to explain you the same in one of the live sessions, but unfortunately there were clouds all over and it was not so clear. And this is the image which I have taken from my camera. So you can see this is the entire Himalayan range, Annapurna Himalayan range, and this is Annapurna 2 or Annapurna Dakshin, as I said in one of the live sessions, and this is what we're talking about, Machu Picchu. So it has a bifurcation and 2 summits. It actually has 2 summits, and hence it's called as Machu Picchu. Yes, you all have given the right answer by saying it's Nepal. Okay. Fine. So how much time has it been? So it's been 40 minutes since we started the session, and I think we lost around 5 to 10 minutes in because of streaming issues. But I'm glad we could complete the session successfully, and it's really good to see so much of active participation, which is the key. Yes, Darshil, I'll definitely consider. I might not be able to do a daily live session as of now, but I'll definitely consider your request because we're working on our e-classes and we have a lot many videos coming up in line for our e-classes. But definitely I'll consider doing as many live sessions as we can, right? Okay guys, so it's really good to see so much of active participation. In fact, I would love to have more and more live sessions but as I said, because of some time constraints and since we need to work towards our e-classes, test series and study club discussions, I'm limiting myself to live discussions as of now, right? But anyways, as I said, we'll have at least one live session every week so that we can have this virtual kind of interaction, right? I'm sure you will enjoy at the same time. It will be more and more informative, right? So, as time unfolds, we'll definitely have more live sessions, for sure. Exactly. Yes, Bernice, I'll definitely share the picture in group, and also I have posted an image, I have a video on the same. You can check out that video in YouTube and also in Instagram. I even posted it in Facebook. Yes. Kirti says, day feels complete with live session. For me, I'll have that sense of satisfaction whenever I complete this live session. Yes, as I said, don't say thank you. I told this n number of times. Rather than saying thank you, just I want to hear this phrase, we will give our best. If you find it difficult to type the entire phrase, just type the keywords as most of you are doing, WWGOB or IWGOB. We will give our best or I will give our best. Take up this slogan, take up this phrase, take up this slogan and just allow this to permeate into your memory, into your brain, into your subconscious memory, and I'm sure this helps you, motivate you at each and every moment of your preparation, right? Remember, it's all about giving your best each and every moment. As I said, this is the time which we're going to get only once in a lifetime, right? So today, as you know, it's 19th April, 8:30 p.m. Indian Standard Time, 8:30 to 9:30. This time we're not going to get once again in our lifetime. So once you realize the fact, you'll be very much careful and you'll try to make maximum use of the given time. So each and every moment is precious. It doesn't mean that you have to keep on studying. It also means that you should keep yourself away from negativity. Even though if you are relaxing, try to relax. Even though if you are watching a TV, give utmost focus to the task at hand. Just try to involve yourself 100% in whatever things you're doing. It can be eating, it can be bathing, it can be any activity, right? Involvement is the key. Enjoying the process is the key. And once you enjoy the process, you'll have successful outcomes. Because it's not by chance, but it's by choice. It's a natural process. I hope you got my point. And if you leave me, I'll just keep on reminding you the same facts day in and day out. So we'll conclude this session now, and we'll see you again next week in another live session. And before I conclude, Toffee would like to say good night, and then we'll say tata. Toffee. Toffee. Hi, Parampreet. Yes, Bernice Prerna, it's really glad to see you all actively involving. I mean, we are associated for more than 2 or 3 years. It's really impressive to see you all live, and I'm very happy. Toffee is sleepy as usual, not because the lecture is boring, but because it finds the lecture irrelevant. The only focus of Toffee is to eat and sleep and play sometimes. That's the harsh reality. That's the ground reality. Toffee. Toffee, say good night. Okay, Akila, so you can show this picture, you can show Toffee now if possible to your lovely kid. Toffee, please don't sleep. Toffee, wake up. Toffee, wake up. Wake up, Toffee. Toffee, please wake up. See, I have a trick to make it more conscious. So let me use that trick. Toffee, Tintawa. Tintawa. You know, Tintawa means, it's in Telugu, it means will you eat. So it understands the word very well, that whenever I use the word, it becomes alert and it waits for its biscuit. Tintawa. So it's really amazing to know the fact that even dogs can understand what we are speaking. It's really an amazing feeling, right? So having pet is a real stress buster, and if you're looking for means of busting your stress, having pet is one such wonderful opportunity. And we are really lucky to have Toffee. Okay then, so we'll conclude the session. So love you all, take care. Good night. Toffee, say bye. 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 Yes, Ankur, I'll definitely teach her all languages possible. Okay, Sarita, that's really sorry to hear. Okay, bye. Good night.